The most common causes of vision loss and cognitive loss is actually interference with the circulation of both our eyes and our brain.
They told us seniors that vision loss is just getting old. That is wrong and dangerous. Losing sight doesn't just mean struggling to read or drive. It means a loss of independence, a higher risk of falls, and more medical visits, bills, and stress. The truth is, protecting your eyes after 65 isn't about expensive supplements, it's about the right daily habits, starting with what you put on your plate. In this video featuring Dr. William Li, you'll learn about 7 powerful seeds, ranked from number 7 to number 1, that help defend aging eyes and the delicate retina. And the first seed is right here, sunflower seeds, which are a natural source of vitamin E, a potent antioxidant that helps protect the cells of your eyes from oxidative damage. You'll discover exactly how much to eat, how to prepare each seed, and which one has the strongest clinical trial results for vision improvement in just 3 months. Dr. William Li, a physician scientist and author of Eat to Beat Disease, whose research on angiogenesis, the way blood vessels grow and stay stable, applies to eye health just as much as it does to cancer prevention. Healthy, well-functioning blood vessels are crucial for the retina, the light-sensitive tissue at the back of your eye that requires constant oxygen and nutrient delivery. Dr. Li's nonprofit, the Angiogenesis Foundation, has advanced public education on foods that protect vision around the world. By the end of this video, you'll have 7 simple, low-cost daily steps, each based on peer-reviewed research, that can help preserve your sight. You'll get portion sizes you can start today, preparation tips to lock in maximum nutrition, and safety notes if you're taking medications or managing chronic conditions.
For most people, vision is one of the most precious of our senses. If you were to rate the senses of smell, touch, taste, vision, and hearing, I think vision would be pretty high up in most people's list. I know it's number 1 for me. I love to be able to see what it is that I'm doing, and it would really be distressing to me if I couldn't see it. So I put vision as one of my highest priority senses. So what's responsible for our vision? How does it connect to what we eat? Well, I actually have been involved with vision research for most of my career because I was so fascinated by the eye. It's this tiny little ball. It's got a lot going on, and it connects to our brain. So actually our eyes are really an extension to our brain. Brain health actually also means eye health. So I want to actually talk about vision first, and then talk about the foods that actually can help you improve and protect your vision.
Your retina is one of the most metabolically active tissues in your body. Every moment you're awake, it's converting light into electrical signals your brain can understand, work that demands a constant supply of oxygen, antioxidants, and structural nutrients. With age, oxidative stress and low-grade inflammation chip away at these delicate cells and the microscopic blood vessels that feed them. That's where seeds come in, tiny but nutrient-dense. They're packed with antioxidants, minerals like zinc and magnesium, and healthy fats that calm oxidative stress, protect blood vessels, and nourish the tear film that keeps your eye surface comfortable. In a moment, we'll start the countdown with seed number 7, the one most seniors overlook, yet it directly supports the lipid layer of your tears, helping eyes feel less dry and vision stay sharper as the day goes on. But first, a quick reminder. Even though seeds are natural foods, any major diet change or new supplement should be reviewed with your clinician, especially if you have age-related macular degeneration, diabetic eye disease, glaucoma, or take blood thinners, chemotherapy, or other prescription drugs. Number 7, black sesame seeds.
Those actually contribute to blood vessel health for your eye, to lower the risk that you might have blood vessels going out of control. They tame the lion. And the other thing that they actually do is they also, because you're eating them, they go into the bloodstream, they also affect your brain. They also protect and tame circulation to ensure better brain circulation as well, better blood flow to the brain. Now, I'm going to tell you, not only has that sort of been shown by the dietary supplements that translate to food, but there, by the way, the other thing that's really cool is that there's some evidence that's starting to develop that these supplements for eye disease also protect against dementia as well. Isn't that cool? All right. Now, foods are really important because we can also protect the blood vessels directly.
Black sesame seeds deserve a place in a senior's kitchen because they offer compounds that may help protect the retina from some of the processes that lead to vision loss. When blood sugar stays high or the retina's tiny vessels weaken, those vessels can start to leak. Over time, this can trigger diabetic retinopathy, retinal swelling, and symptoms like floaters or blurred central vision. Ignoring early changes can lead to more frequent injections, additional laser treatments, and a higher risk of permanent vision loss. According to research studies, black sesame contains antioxidant lignans, sesamin and sesamolan, along with minerals that support eye health. In animal models of diabetic retinopathy, sesamin lowered disease progression by reducing microglial activation and inflammatory signals in the retina. A research report in the Journal of Neurophysiology also showed that sesamin could block high glucose-induced inflammation in retinal microglia, which are immune cells in the eye linked to vision loss when overactivated. Adding black sesame to your diet is simple. Aim for 1 to 2 tablespoons of toasted seeds daily. Sprinkle them over oatmeal, yogurt, or rice, stir them into smoothies, or blend them into tahini or black sesame paste for a spoonable addition. If chewing is difficult, grind the seeds lightly before adding them to food. To keep costs down, buy in bulk and store them in a cool, dark jar to protect the natural oils from going rancid. A few safety notes. Human retinal trials are limited, so keep expectations realistic and view sesame as part of a complete medical plan, not a replacement for it. If you have a sesame allergy, avoid them altogether. Right after the next seed, you'll get a 1-minute breakfast idea that combines 2 seeds to help cut afternoon eye burning. Number 6. Sunflower seeds. Sunflower seeds are one of the easiest, most affordable ways for seniors to support their eyes against everyday oxidative stress. The retina is packed with delicate fats and uses a high amount of oxygen, which makes it especially vulnerable to oxidative damage. Without enough antioxidants, damage to retinal cells and the surrounding tissues can build up over time. This not only speeds the changes seen in age-related macular degeneration, AMD, but can also slow down the eye's ability to recover after exposure to bright light or other stress. According to the University of Rochester Medical Center, 1 ounce of dry roasted sunflower seed kernels provides roughly 7.4 milligrams of vitamin E, a fat-soluble antioxidant that plays a key role in protecting cell membranes from oxidative harm. Large, long-term clinical trials from the National Eye Institute have shown that a specific antioxidant and zinc combination, known as the AREDS or AREDS2 formula, can slow the progression to advanced AMD by about 25 to 30% in people at higher risk. While vitamin E alone hasn't shown a major effect on AMD risk, in combination with vitamin C, zinc, copper, and in the case of AREDS2, lutein and zeaxanthin, it contributed to meaningful benefits for those already at risk. A simple way to bring sunflower seeds into your daily routine is to enjoy 1 to 2 tablespoons of roasted, unsalted kernels each day. Sprinkle them over salads for crunch, stir them into yogurt for texture, or combine them with pumpkin seeds for a nutrient-dense trail mix. Keep them in an airtight container in a cool, dark place. Heat and light can degrade vitamin E over time. Since sunflower seeds are calorie-dense, measuring your portion rather than pouring from the bag can help maintain a healthy weight. If you're already taking an AREDS2 supplement, you're likely meeting your vitamin E needs, so focus on food sources rather than high-dose vitamin E pills unless your eye doctor recommends otherwise. Up next, in less than 30 seconds, you'll learn about the zinc-rich seed that not only supports immune function but also acts like a gatekeeper for night vision by helping vitamin E reach your retina. Number 5. Pumpkin seeds. Pumpkin seeds, also called pepitas, are one of the easiest, most nutrient-dense ways for seniors to bring more zinc into their diet, and zinc is essential for healthy retinal function. When zinc is low, the transport of vitamin A from the liver to the retina slows down. This directly impacts the rod cells in the retina, which are responsible for night vision, and can lead to difficulty seeing in dim light. In age-related macular degeneration, AMD, insufficient zinc can mean faster progression toward late-stage disease, which often brings the need for more frequent injections, surgical interventions, and potentially permanent vision loss. According to the National Eye Institute, the AREDS and AREDS2 clinical trials found that a nutrient formula including zinc along with antioxidants slowed the progression to advanced AMD by about 25 to 30% in people at intermediate or high risk. Food is not a replacement for supplements in those who meet the criteria for the AREDS2 formula, but it is a smart way to support zinc intake naturally. For daily use, aim for about 1/4 cup of unsalted, hulled pepitas. You can stir them into oatmeal, toss them over salads, or roast them lightly with a pinch of cinnamon for a satisfying snack. Combining pumpkin seeds with sunflower seeds, the vitamin E-rich choice from number 6, makes a nutrient pairing that mirrors parts of the AREDS nutrient blend using whole foods. A word of caution: if you are already taking an AREDS2 supplement, which in its original form included 80 mg of zinc, avoid adding high-dose zinc pills on top without medical guidance. For most healthy adults, food sources like seeds are safe, but those with kidney disease or on mineral-restricted diets should confirm portions with their clinician. One composite example: a 74-year-old reader noticed that letters seemed to ghost at dusk. After an eye exam and a conversation with her doctor, she began adding 1/4 cup of pepitas to her breakfast and took the AREDS2 formula her retina specialist recommended. Within a month, she reported better confidence navigating in low light. While this is not a cure, it shows how small, consistent food changes can help support medical care. Coming up next, you'll meet the seed that can strengthen the lipid layer of your tear film, helping to reduce gritty, end-of-day burning and support more comfortable vision. Number 4. Flaxseed.
Good source of protein. Great source of omega-3 fatty acids. Omega-3s not only cut off the blood supply to cancer, lower inflammation, help your lipids, but they also protect your stem cells. These are the stem cells in your body that actually help to heal us from the inside out. They regenerate our body. You don't feel them. They're actually doing their job invisibly, helping to repair organs, blood vessels, very important for longevity. 10% reduction in mortality due to cardiovascular disease, probably because of the omega-3s. That are found in there, but also protein counts as well, lowered the risk of heart attack and stroke. Okay, reduction in mortality from heart attack and stroke, that's by 10%. Had a 6% reduction in cancer mortality. That's probably due to the omega-3s as well. Omega-3s also cut off the blood supply, feeding cancers. 20% reduction in mortality from lung disease. Now, I don't have a mechanism for that, but maybe due to reduction in inflammation, maybe improvement in immune defense, and it had a 37% reduction in death from liver disease. They also had a 38% reduction in mortality from Alzheimer's disease. All right, that's brain health. All right.
Flaxseed, when freshly ground, is one of the most potent plant-based tools seniors can add to their breakfast to support eye comfort and long-term retinal health. As we get older, the tear film that keeps our eyes moist and clear becomes unstable. Tears evaporate more quickly, leaving the eyes stinging, gritty, and blurry, especially during reading, driving, or computer use. This chronic dryness, known as dry eye disease, doesn't just feel uncomfortable. Left unaddressed, it can make outdoor wind painful, limit safe driving, and reduce overall quality of life. Flaxseed is one of the richest plant sources of alpha-linolenic acid, ALA, a type of omega-3 fat that the body uses to make anti-inflammatory compounds. Dietary omega-3s, including those from flaxseed, have shown benefits for some dry eye patients, improving tear quality and comfort. In 2023, a randomized clinical trial published in the Journal of Clinical Ophthalmology and Research tested flaxseed combined with other omega-3s over 12 weeks. The results were promising. Many participants experienced measurable symptom relief by week 4, with further improvement by the study's end. 1 tablespoon of ground flaxseed provides roughly 1.8 to 2 grams of ALA for daily use. Aim for 1 to 2 tablespoons of freshly ground seeds, stirred into yogurt, blended into smoothies, or mixed into overnight oats. Whole seeds pass through the gut largely undigested, so grinding is essential for nutrient absorption. Buy whole seeds, grind a week's worth at a time, and store them in the fridge or freezer to protect the delicate oils from oxidation. Drink water alongside flaxseed to help the fiber move smoothly through the digestive tract. If you're on blood thinners or have gastrointestinal strictures, confirm safety with your clinician before starting flaxseed. Flaxseed oil also contains ALA but lacks the beneficial fiber, making whole seeds the better all-in-one choice for most people. Coming up next, you'll meet a seed with a rare omega-6 fat that behaves differently from the typical pro-inflammatory variety, and it could help calm dry eye symptoms from another angle. Number 3. Hemp seeds. Hemp seeds are one of the rare seeds that provide a healthy fat called gamma-linolenic acid, GLA. Unlike most omega-6 fats that can promote inflammation, GLA is converted in the body into compounds that help calm it. This is important for eye health because dry, red, and gritty eyes are often caused by low-grade inflammation in the tear film. When that inflammation continues, your tears evaporate faster, leading to discomfort, blurred vision, and reliance on eye drops without lasting relief. Hemp seed oil typically contains between 0.5% and 6% GLA. Once in the body, GLA changes into dihomogammalinolenic acid, DGLA, which supports the production of anti-inflammatory prostaglandins, chemical messengers that help tissues heal and maintain comfort. To incorporate hemp seeds into your day, aim for 2 tablespoons of whole hemp seeds, often called hemp hearts. You can sprinkle them on whole grain toast, toss them over a salad, or blend them into smoothies. They have a mild, slightly nutty flavor that works well in both sweet and savory dishes. Hemp seeds are food safe and contain no psychoactive THC. However, if you take blood thinners, have an upcoming surgery, or are making large changes to your dietary fat intake, it's smart to talk to your doctor first. Up next, we'll cover the number 2 seed, a proven powerhouse in a year-long clinical trial for improving a key sign of diabetic retinopathy. Number 2, grape seed extract.
So the key thing is that the foods that actually can be used to protect that carpet of neurons, interlaced with blood vessels, keeping those blood vessels healthy, taming those abnormal blood vessels, also turn out to be protective for the brain as well. And so here is sort of a twofer, right? The brain, like your skull, is really a 2-level house, okay? The brain is on the upstairs, on the 2nd floor, and underneath the floor, which is the bottom part of the skull housing your brain, on the 1st floor are your eyes. So the part of your brain that's on the 1st floor are your eyes, and then you walk upstairs, and now the brain's right there. And so this connection, just like in your house, of the circuitry and the circulation between your eyes and your brain suddenly makes sense. And what we eat can be good for the brain, good for the nerves, and what's good for the brain, the blood vessels and the nerves in the brain, also good for blood vessels and nerves in the eyes.
Grape seed extract, also called GSPE, comes from the small seeds inside grapes. These seeds have special plant compounds called proanthocyanidins that help protect tiny blood vessels in the body, including the delicate vessels in your retina. The retina is the part of your eye that lets you see clearly. In some eye problems, like diabetic retinopathy, these small blood vessels can start to leak. When that happens, fatty deposits and swelling can build up in the macula, the central part of the retina you need for sharp vision. If this swelling keeps getting worse, it can lead to serious vision loss and more treatments like injections or laser therapy. According to a study in Medicine, people with early diabetic retinopathy who took 150 milligrams of GSPE daily for up to 12 months had better results than those taking a placebo or another drug called calcium dobisalate. The GSPE group showed fewer fatty deposits and less swelling in the macula after several months. This means GSPE may help slow changes in the retina when used alongside your eye doctor's treatment plan. You can eat grapes and foods that include grape seeds, but the clinical results came from a purified GSPE supplement. If you want to try it, talk to your doctor first, especially if you take blood thinners, have diabetes, or have an eye surgery planned. Take it with food to avoid stomach upset, and choose a brand that's been tested by a trusted third party to make sure it's pure. GSPE can sometimes lower blood pressure or blood sugar, so it's important to keep track of these with your healthcare team. The final seed, our number 1, is tucked inside a bright red berry long celebrated in traditional medicine. Modern double-blind trials show it can boost protective macular pigments and strengthen your retina in just 3 months. Number 1. Goji Berries, wolfberry seeds. Goji berries, also called wolfberries, are small red fruits with tiny edible seeds inside, and they are one of nature's richest sources of zeaxanthin, a carotenoid that helps protect the macula, the central part of your retina responsible for sharp vision. The macula acts like the eye's natural filter against harmful blue light, but as we age, macular carotenoid levels drop. This can increase your risk of age-related macular degeneration, make you more sensitive to glare, and worsen night vision. If left unchecked, these changes can speed up the path toward central vision loss. According to a study in Nutrients, healthy adults aged 45 to 65 who ate 28 grams of goji berries, 5 days a week for 90 days, had higher blood levels of zeaxanthin and increased macular pigment optical density, MPOD, a key marker of macular health, compared to controls. This finding suggests that goji berries can help restore the macula's protective pigments, giving your eyes a stronger natural shield against light damage. To use goji berries for eye support, aim for about 1/4 cup, 28 grams, of dried berries per day. You can eat them plain, soak them in water to soften, or add them to oatmeal, yogurt, or trail mix. Their sweet tart flavor pairs well with nuts and seeds, making them a great addition to an eye health snack mix. Choose unsulfured and unsweetened varieties to avoid unnecessary additives. Goji berries can interact with warfarin and possibly other blood thinners, so it's important to talk with your doctor before adding them if you take these medications.
There's many other foods that actually have lutein and zeaxanthin and vitamin A. You want to actually get a regular eye exam with your ophthalmologist and do an eye exam at home. Cover up your eyes and see if you can actually read well. If you can't, if you got blurred vision or black spots or blurry spots, you might want to go see an ophthalmologist. And after you see an ophthalmologist, I'll tell you, be compliant. Follow the instructions of what they tell you, especially if you have any follow-up visits. All right, you don't want to lose your vision. Your eye doctor, your ophthalmologist is there to take care of your vision. All right, so it's up to you to protect your vision. Your ophthalmologist will help you do it at the medical level, and there's foods that you can actually eat in order to be able to help protect your vision as well.
In one composite example, a 68-year-old gardener dealing with glare issues while driving began adding a small handful of goji berries to breakfast 5 days a week. After 3 months, her follow-up scan showed a measurable rise in MPOD, and she noticed less glare discomfort in bright sunlight. While food is not a cure, it can be a meaningful part of a broader plan to protect vision. In just 20 seconds, you'll get the 7-day Seed and See plan, simple, low cost, and easy to follow alongside your eye doctor's care. The goal is to lower oxidative stress, feed the tear film, and support the tiny blood vessels in the retina by using daily seed habits. Every day begins with a base routine. At breakfast, stir 1 tablespoon of ground flaxseed into oatmeal or yogurt and add 1 tablespoon of hemp seeds on top. This combination of ALA and GLA supports tear film comfort. As a snack, enjoy 1 tablespoon of sunflower seeds and 1 tablespoon of pumpkin seeds, giving you natural vitamin E and zinc in food form, 2 key nutrients from the AREDS research. At dinner, sprinkle 1 to 2 teaspoons of toasted black sesame seeds over vegetables or rice for lignans and minerals that may help calm retinal inflammation. If your clinician agrees, you can also add a grape seed extract capsule, 150 milligrams with lunch. If you have early diabetic retinopathy, and 28 grams of dried goji berries at bedtime for early AMD. The goji berries are rich in zeaxanthin, and studies show they can raise macular pigment density in just 3 months. By day 7, you may notice your eyes feel less gritty and dry, especially with steady flax and hemp intake. Just remember to stay hydrated. By day 30, improved zinc and vitamin E intake from sunflower seeds and pumpkin seeds may help reduce night glare, but always discuss changes with your doctor. At day 90, if you've added goji berries or grape seed extract, this is the point when clinical studies check for measurable changes. Keep up with your scheduled eye scans and never stop prescribed AMD or DR treatments. To get the strongest benefits, protect the delicate oils and seeds from heat, air, and light by storing them in sealed jars in a cool, dark place and refrigerating ground flax. Grind flax and sesame just before eating to maximize absorption, and toast sesame lightly without burning. Always choose unsalted seeds to protect blood pressure. Pair seeds with colorful plants, leafy greens, orange vegetables, or yellow fruits, for extra lutein and zeaxanthin, 2 key pigments for the macula. Drink water throughout the day to help fiber do its job without causing constipation. For fast, eye-healthy meals, try 3 quick recipes. Clearview oats takes 5 minutes. Cook oats in water or milk, stir in ground flax, hemp seeds, sunflower seeds, and top with berries. Pepita Power Salad comes together in 7 minutes with mixed greens, olive oil, lemon juice, pumpkin seeds, sunflower seeds, and a protein like feta or chickpeas. Black sesame rice topper takes 10 minutes. Toast a 1/4 cup of black sesame seeds, grind lightly, and sprinkle over rice or vegetables. Some people need extra care. If you have seed allergies, avoid those seeds. If you take blood thinners or have surgery planned, talk with your doctor before adding goji berries or grapeseed extract, as these can interact with medications. People with diabetes should monitor blood glucose when changing their diet, and those with kidney disease should check mineral levels from seeds. If you have intermediate AMD, Stay on your AREDS2 supplement unless your eye doctor says otherwise. For dry eye, omega-3s and GLA can help many people, but track your own symptom changes over 8 to 12 weeks. Small, daily seed habits are simple, safe, and smart. With your doctor's guidance, they can help you protect your eyes, slow decline, and, for some, even see better. Share this video with a loved one and make sure to subscribe to our channel for more health tips.